Well, as we've mentioned, tonight we are speaking to Kenyans in lockdown in 3 cities around the world as countries fight what leaders are now terming the invisible enemy, the COVID-19 pandemic. And we're speaking now to Professor Raymond Macharia, who's in Luton, that's just outside of London in the United Kingdom. And very good evening to you, Professor. Thank you very much for joining us. First of all, we hope you're coping well in the United Kingdom. Here in Kenya, the government has shut down schools, has urged people to work from home, and has even banned non-essential travel. What measures have been taken in the UK? And from your perspective, what is working?
People are trying various strategies, but just like in Kenya, first and foremost, the schools were just closed on flight, and institutions have started also to close down, particularly universities, and sending the students away. In some cases, obviously, it happens that students have gone home earlier because of extramural studies and so forth. But the government is working. If having any signs, you can work from home or you can stay away from work, and therefore there is facilitation so that you can stay at home and work from home. And so you can self-isolate and work from home.
What would you urge the Kenyan government and citizens here back home to do based on your experience and fears that there may be need for a complete lockdown?
I think one of the things we'd say, like now you mentioned that students have gone on recess or they've gone on holiday. And I think it's very important that they should understand that they have not gone home to go and stroll around, but they should actually go and stay at home. This disease is a very serious disease, and it's the same thing we are telling people here, young and old. It doesn't matter. We need to self-isolate or stay at home, self-quarantine until this disease can be overcome. And so I just want to say that people should still have that, what you'd call social distance. And I want to use the word carefully here. We need to think about physical distance, not social distance. We want to have social solidarity so that when people go into their homes, they can keep in touch with each other, they can talk, they can share what they are going through. And more importantly, that correct information should be shared and not panic and rumors. But we want to say that the government should follow government guidelines about what is happening, how we should overcome the condition, and adhere to what the government is saying.
Appreciate that differentiation. There's a difference between social distancing and physical distance, and that is what we're looking at, physical distance. Thank you very much, Professor, speaking to us from Luton in the United Kingdom. And we're going to, of course, reach out also to other Kenyans who are in a lockdown scenario. We want to take you very shortly to Italy, which has been hardest hit by the COVID-19 virus, indeed surpassing the cases in China, which was the epicenter of the virus. And we now want to cross over to Italy, as I've just mentioned, which is one of the hardest hit countries in the world, to speak to Emily Jelagat, who is a Kenyan residing there. And I believe you're in Milan, Emily, and hello to you, and I hope you are doing well. We want to...
Yes.
Fantastic, fantastic. In Italy, we've seen the death toll from the coronavirus surpass that of China, where the pandemic broke out. There are now well over 47,000 deaths in Italy. The military has been called in to enforce a lockdown. How are you faring under these difficult circumstances, and what has your experience in lockdown been so far?
Okay, here we are on lockdown, and we are just indoors. We are left just staying indoors. And the situation here is difficult. The situation here is, there's a real struggle here. People are not moving around. Initially, there were people moving around, but at the moment, the position we are now, people are becoming, are responding to the regulation to stay indoors. And yes.
We've also seen some encouraging pictures, beamed around the world of Italians literally singing to each other across balconies. Would you say that even, with such a heavy death toll, that there is still some sense of hope?
Yes, there is still hope There's still hope that Italy will overcome this, and also the entire world will overcome this because of the energy, the kind of effort that is going on. There is a proof that we will overcome this.
Right. In Italy in particular, medical staff are concerned that young people are not paying attention to the warnings. We've seen hospitals that are receiving people in their 20s and 30s admitted to the intensive care unit, with very severe cases of the coronavirus. Would you say that young people such as yourself are now waking up to the reality that they are not immune to COVID-19?
Yes, young people now are becoming cautious because they see now it's not only restricted to old people, it's able to infect even the young people, and the young people might also end up even in the ICU position. So everybody now is taking the responsibility and watching the regulation given.
Finally, as you know, here in Kenya, we are not in your position. We're not in a complete lockdown. People are still able to move about, albeit with a few restrictions. And they are concerned that we may get to the level where a complete lockdown is enforced by the government. What would you say to Kenyans? How can they prepare for such an eventuality should we get there?
Okay, what I will tell Kenyans is to stay home. Let us stay home, let us stay indoors and follow the regulations that are given. Because this number began, here in Italy, it began from 2, it went to 3, and all of a sudden the number went up. So we are in a better position to stay indoors, observe the regulation given by the government, by even the experts, and we will be safe. You find that there is a journalist who came here to show his people what Italians are going through, what is really happening. So let us not wait to that time, but let us act now.
Thank you very much, and we wish you well. We hope you stay safe in Milan, of course, one of the cities that is hard hit and on lockdown in Italy. We're continuing to speak, of course, to Kenyans around the world. They're giving us their first-hand accounts of their experience in lockdown, and very shortly, we want to be able to take you to the United States, of course, a country where U.S. President Donald Trump is expected to release into the U.S. market a drug that has been previously used to treat malaria. We're having that conversation very shortly. We continue with our coverage, and we want to take you now to the United States, in particular Portland, Oregon, where another Kenyan is, of course, grappling with what we all are the world over, lockdowns, and are starting to, shut down various countries in order to contain the COVID-19 virus. And joining us now is David Wahome via Skype. And David, thank you very much for speaking to us. Start by telling us how you're faring, and are you in a partial lockdown, and what does that really mean in your context?
Hi, Anne. So the region that I'm in is on a shelter-in-place lockdown, which simply means that you do not go out unless really you need something urgent. This is to limit the contact between persons, and everybody is actually aware of the implications of the contact. So we are all supposed to be about 6 feet apart when you go to do your grocery shopping or wherever you are between people. This helps contain the rise of the virus within the region, and that's really key here. The day-to-day things that we do have been affected in such that schools are closed, work is closed, unless, of course, you're within the emergency services, so you're supposed to go to work. The transportation system is kind of clogged up because it's shut down in between cities, and internet usage out here is extreme. We are trying to only use internet as we need it because the emergency services are leveraging a lot of it as they work to attend to those cases of COVID-19 that are within this region.
Right.
So our daily life is completely upside down.
You've used the term shelter-in-place lockdown.
Yes.
How does the government
Yes.
enforce that?
So the state of Oregon and the governor of Oregon mandate people to stay within the regions that they're in. This is a request. It's not formalized into law yet here in Oregon, like California or Washington, where it's actually been formalized into law, and that's a total lockdown of the state. The shelter in place is a request that we all follow, because we are trying to make sure that the people within our communities, especially the guys who work within the hospitals, the police, the fire people, have a clear pathway when they need to go out and reach the affected residents of the state. There is also a shelter in place, a mandatory order for specific healthcare homes where people are of a certain age range. So we have not yet gotten to the partial lockdown or complete full lockdown, because our cases in this region, especially of Oregon, are not as high as those of Washington or California. Those are the two out of the 3 states in the US that have critical COVID-19 affected persons.
You've also talked about how this is affecting internet usage, which may sound strange, because here at home, whereas we've been given, similar advice, nothing's wrong with the, internet. There isn't this sort of limited usage, at least to the best of our knowledge, that would allow emergency workers in different sectors to be able to communicate and reach out to people. How would you say that then affects your sense of community, your ability to be able to reach out to people even whilst you're isolated in a sense?
So we are communicating through video, through WhatsApp, and a lot of us are trying to keep that interaction to kind of keep each other's spirits uplifted. And we are communicating across the country. There is a Kenyan network that everybody reaches out to, and we all talk as and when we can. Because the schools are generally closed all over the nation, learning is taking place through online mediums. This stresses both the internet grid systems, the electrical systems, and the water systems. So you can imagine, we are normally used to everybody waking up and going to school or going to work, so everything's kind of balanced. So now you have everybody in place at the same time, leveraging everything at the same time. So all the governors are requesting the populations within each respective state to really be conscious about your community and really understand that everything is so stressed out that we need to leave space for those emergency services that need access to those tools or features or functions or areas, so that they can be able to reach the sick people.
Right. U.S. President Donald Trump has said that an anti-malaria drug that could help fight coronavirus will be available in the U.S. within days. How do you feel about that?
Well, this is an interesting development, and as a person within the region that's affected, I mean, any drug that has the possibility of saving lives is very welcome. We are following guidelines by Dr. Fauci of the CDC, who has informed the nation that this drug will be available on a test by test basis, depending on whether that individual's health DNA makeup is receptive to it. So we are welcoming any information pertaining to any life-saving drug that can help change the way we live.
Very briefly, your message to the Kenyan government and to Kenyans who are watching you right now, who are concerned that we may have to take perhaps more severe steps towards a type of shutdown to stop the spread of COVID-19 here at home. What would you advise them?
I think the Kenyan government has done a lot when you put everything in context, because the Kenyan government is working on a different healthcare system and parameters. So they've done a lot more and paid a lot more attention than the US, because the US is playing catch up in some areas, even though the healthcare system is much more advanced. So when you look at it in that context, they are doing the best that they can within the system that they can. Of course, there is a lot of need for a lot of improvement within all systems, because this disease is proving to us that everything within our system can be stretched to the limit. And I really want to urge Kenyans to not play around with this. This is not a hoax. This is not a fake story. We are seeing in our regions people dying.
Right.
There are Kenyans who work within the healthcare system in the US, and they are communicating that this is really not a joke. Please follow all the health guidelines that you're being given and take care of your old people.
Thank you very much for that, and we wish you well. Stay safe, and thanks for speaking to us.
Thank you, Anne.
Thank you very much. We're going to take a short break, and we're back with more news, our continuous coverage of COVID-19 or the coronavirus here in Kenya, in Africa, and around the world. Stay with us.